Mental health credentialing takes 60 to 120 days. Bill before your effective date, and most payers deny the claims outright. Credentialing is the gate between a licensed clinician and insurance reimbursement. Until complete, you cannot bill in-network. In this guide, what credentialing is, the 6-step process, payer timelines, the most common delays, and how the right platform is designed to keep your revenue cycle from stalling. Whether you are a solo therapist or a multi-site treatment center, this is the credentialing roadmap. So what exactly is provider credentialing? Credentialing verifies a provider's education, state licensure, training, malpractice history, and background before they are allowed to bill a payer. 3 steps must all be complete before a clean claim pays in-network. Credentialing verifies quality, contracting sets rates, and enrollment activates billing. Here is what is at stake when credentialing is not managed correctly. Most payers deny claims for services before the effective credentialing date. Some Medicaid programs classify pre-credentialing billing as potential fraud, triggering recoupment. If a license or malpractice policy lapses, insurers can suspend the provider from the network and deny claims until resolved. The credentialing process for individual providers follows a consistent 6-step sequence. Miss any step, and the entire timeline resets. Let us walk through all 6. Step 1. Gather your foundational documents and identifiers. You need an active state professional license, a national provider identifier, and a tax ID or EIN if practicing as a business entity. Add malpractice insurance, board certifications, a detailed CV, and professional references. Pre-assemble everything digitally. Each payer will ask for the same packet. Step 2. Set up and maintain your CAQH ProView profile. CAQH ProView is the centralized database most U.S. insurers use to obtain your credentialing data. The profile is free. Providers must reattest every 90 days. An expired attestation is one of the most common causes of credentialing delays and network terminations. Step 3. Submit applications to each payer you want to join. For Medicare, use the CMS 855I through PAYCOS. For Medicaid, apply through your state portal, then separately with each managed care organization. Start all applications simultaneously. Running payers in sequence multiplies your wait time by the number of payers. Step 4. Primary source verification, the stage that takes the most calendar time. The payer contacts your state licensing board, checks board certifications, and queries the National Practitioner Data Bank, not just reviewing your copies. Any match on the OIG or SAM exclusion list halts credentialing until cleared. Pre-check all new hires before applications go out. Step 5. Committee review and contracting. Once verification is complete, the credentialing committee reviews the application and issues a participation contract. Confirm the effective date in writing. That is the earliest date you can bill in-network without risk of denial or recoupment. Step 6. Enrollment completion and ongoing maintenance. Being credentialed and contracted is not enough. Enrollment must be active in the payer's billing system before claims process. Most payers require re-credentialing every 2 to 3 years. The NCQA standard mandates at least once every 3 years. Payer timelines vary significantly. Plan your credentialing runway before the first patient encounter. Private insurance credentialing takes 60 to 120 days from a complete application, with 90 days being the common estimate. Medicare individual enrollment through PAYCOS generally takes 30 to 60 days when the application is error-free. Treatment centers opening in a new state should plan for at least 120 days for commercial payers and 180 days for full Medicaid network participation. Generic EHR platforms treat credentialing as a separate manual process. Behave Health's RCM module is designed to connect credentialing status directly to billing. The platform tracks license and credential expiration dates and is designed to surface alerts before a lapse triggers network suspension. A payer roster links each clinician to each contracted payer and effective date, designed to block claim creation before credentialing is live. Credentialing-linked denials surface in the RCM dashboard as their own category, so billing teams can act the day they occur. Stop losing revenue to credentialing gaps. Book a 20-minute demo at behavehealth.com and see credential tracking, payer rosters, and denial management in a single platform. Book a 20-minute demo at behavehealth.com.